feel free to just open your mic and talk. How are you guys doing? Are you guys in exam preparation mode, assignments? What's going on?
Just chilling. I don't know what's a chilling with, but just chilling. Kind of have to get the stress out before participate in any sort of studying or whatnot.
Wow, Marisha, you are just chilling. At this time of the semester, Marisha is just chilling.
Yeah,
Albie,
man.
do you have the belt nearby?
What a sense me did for the work and the work still gonna exist after me dead. So I might as well just chill.
Is anybody else like Marisha just chilling, or is everybody else swamped with work and just trying to get things done and out of the way? Or is it just me?
Most of assignments on assignments, every day is group work, this group, that group. It's hard to keep up sometimes. Really.
Sounds like the life of a student.
That's it.
Sounds like the life of a student. But guys, let's just keep courage, keep faith. I know some of us are in our first year, final semester. Some of us are in our second year, final semester. And some of us are looking to go through the gates of UE in our final year, final semester. Congratulations to those persons. Keep your head up and keep on swimming. So let's jump right into what we have to do today. So, Marisha, you can run your icebreakers.
Okay, so let me just get my um PowerPoint up. It's a short icebreaker, so we can just sit and relax as I explain or expose us to these new words. The icebreaker includes 10 new words, or rather, words that have been around for a very long time, but most of us would either have not come across these words or we just don't know that they actually, hold on. Okay, great. That they actually meant something that was pretty common seen. So these are some obscure words. Okay. So the first one, can you see my screen by the way? Let me just make sure that's happening.
Yes, Marisha, we're seeing.
Okay, great. So the first one is petrichor, right? So when you feel like it's about to rain and you start sniffing the air, petrichor is what you're sniffing. It's when the rain mixes with the earth, and I don't remember what is dissolved into the water, but that's the earthy smell you get when it's about to rain. And then you have griffonage. Oh, the N should be before the E. Griffonage is what you would describe as chicken scratch. So when you see illegible writing, that's actually griffonage. I don't know why it had to have a whole new name, but that's what it is. Then we have a hemord nelap. Okay, so that's a word where when spelt one way, it has, well, one meaning. And when it's mirrored, it has a completely different meaning. So what you're seeing in the picture beside it is stressed, and stressed spelled backwards is dessert. And funnily enough, semordmenap is actually a semordmenap. So when you flip it, the next word that it becomes is palindromes. So a palindrome is a word that when you mirror it, it's still spelled the same and means the same. So a word like level, Level, you flip that, it's still level. Mom, MOM, stuff like that. So then you have a caruncle, which is the triangular piece of flesh that's in the eye. That's where like person say your tear duct is. When you're when you wake up in the morning and you start to clear your eyes, the section that's closest to your nose, that's your caruncle. Then we have a tittle. And that's the dot that you put above the the lowercase I and J, as well as below the what do you call it, exclamation mark or a question mark. So tittle. And you have a zarf. Now, I don't know why this needed to have a name, but here it is. It's the sleeve that you put on a beverage holder. So You know, when you're watching those shows and you see the coffee cups and it has that brown ring around it, like what's pictured. In some cases, some of us have water bottles and they come with like um, this rubber band that's around the bottle. That's a zarf, or at least a depiction of a zarf. Then you have a contronym. So it's a word that in and of itself can be both its opposite and whatever predetermined meaning you wanted from it. So weather, right? Weather can be to wear down something. So like weathering a rock, when you expose it to water, it whittles down to nothing. Or it could be to withstand. So you and your partner weather the storms of marriage, right? Same thing with something like cleave. If you cleave something, look at when you cleave a piece of meat, you cut it apart. But also to cleave is to stick together. Um, so a group of crows is called a murder. It's archaic. Now people just call it a flock of crows, just like any other set of birds. But yeah, that's what they used to be called. And the final one, an unkindness, is a group of ravens. So that concludes the icebreakers. Um, I hope they were as fun for you as they were for me. I couldn't stop raising my eyebrows when I was reading some of these. So yeah, that concludes the icebreakers.
Marisha, I must say that you are definitely the icebreaker queen. Like the type of icebreakers that you come up with, I have never seen before. So yes, these were really interesting for me.
I'm taking a bow.
Hi, Jamila, are you still speaking?
Oh
I
no,
don't
I
think
stopped.
so.
I was just commenting on Marisha's icebreaker and
I thought
commenting.
you were just going to run the program, anyway.
Oh, sorry. I'm so sorry.
Okay, well, yes, I must agree that Marisha is just way outside of the box. And I think this is a part of her chilling. And I just want to make a disclaimer on behalf of the illustrious Marisha, that Marisha chills in the day and works at night. Don't let her fool you. I tell you all the time. If you have a problem with an assignment, you can call Marisha at 2 a.m. I'm just putting that out there.
Yeah, you can. I don't sleep.
She's wide awake like it's 12 o'clock. Trust me. All right. Well, today we have a very interesting episode of PSA Weekly for you. And PSA, we're always trying to make our content relevant. And today we're doing, this must be like our third collaboration, don't you guys? Today I think we should get prize for the most collabs. So today we are collaborating with the Physical Therapy Students Association at UMona. And we have a lovely guest. We have the president with us today, Miss Demi Guevara, and she will be presenting to us. And this month, March is Developmental Disability Awareness Month. And we saw the opportunity to produce a session which focuses on some of the psychological implications of living with a disability. As budding psychologists, some of us may have some interest in the areas of psychology that deal with rehabilitative care for persons living with a disability, and especially disabilities that are common but often only vaguely considered in our society. So today we're going to take some time to discuss this whole topic of disability, and one that is quite pertinent to us. So today, Demi has joined us from the UMona Physical Therapy Students Association. Demi is a finalizing student in pursuit of a BSc in physical therapy, and she's going to be speaking to us today about Down syndrome. And as part of her physical therapy training, Demi has had the opportunity to provide treatment to persons living with this disorder. and she has agreed to share some of that experience in order to help us acquire a better understanding of a disorder that is quite common in our society. She will give us some perspective on what the disorder is, what physical therapy for this disorder might look like, as well as some of the psychological implications of living with a disorder that poses a physical disability. So I invite you now to turn up your speakers, listen carefully to Demi, and I'm sure you're gonna have loads of questions like we always do for her. So at this time, I would just like to welcome Demi to begin her presentation.
Hi, good afternoon, everyone. I hope everyone is feeling good and they're ready. All right, so just let me share my screen with you guys. I just have to be allowed to share screen. Right here. Okay, so okay, so everyone seeing the screen?
Yes, Miss Guevara.
All right. So my experience with treating a person with Down syndrome is a bit of a personal one, meaning I saw this patient almost every day, right? He was a young man. He had quadriparesis secondary to cervical myelopathy, along with having Down syndrome. So he was going through a lot. So that's just my little backstory on how I had this presentation to do. So what is Down syndrome? Down syndrome or Down syndrome is a genetic disorder caused by the presence of all or part of a third copy of chromosome 21. I think most of us have heard about that part. It's usually associated with physical growth delays, mild to moderate intellectual disability, and characteristic facial features. The average IQ of a young adult with Down syndrome is 50, or equivalent to the mental ability of an 8 or 9-year-old child. But as we know, this will vary from person to person. So some of the physical features. So I have a nice little picture here of a baby. So we can see the it's all forehead, right? We can see the downward slants on the eyes, right? So here we have it, flat back of head, protruding tongue, small ears, small mouth, flattened nose bridge, short fingers, loose skin on the back of the neck, right? And we can see all of that shared in this photo right here, along with a little more, right? So the etiology. So I found out when I was doing research, there are 3 different types of Down syndrome. Anyone knew that before?
No, I just thought it was one big
No.
thing.
Well, I was shocked, and I think you would be as well. So there are 3 types actually. Trisomy 21, which is the most common one. So Down syndrome is usually caused by an error in the cell division called non-disjunction. So non-disjunction results in an embryo with 3 copies of chromosome 21 instead of the usual 2. So that defect is what causes the Down syndrome. So, well, trisomy 21, this particular one. So prior or at conception, a pair of the 21st chromosomes in either the sperm or the egg fails to separate. All right. So as the embryo develops, the extra chromosome is replicated in every cell in the body. This type of Down syndrome, it accounts for 95% of the cases. So it's the most common type. So this is the normal cell division that happens, right? We have the 23 chromosomes from the mom, 23 chromosomes from the dad coming together to have the 46, right? And then we have further division to create the baby, quote unquote, right? So this is what happens in trisomy 21, right? Here we can see, I don't know if you can see my mouse, my cursor. Yeah, no? So we have 22 here and then 24.
Yes, we can see it.
on the other side, you see in 23 and 23, right? So here is where the non-disjunction happens, and this is where the defect starts. So the other one is mosaicism, right? It's diagnosed where there's a mixture of two types of cells, some containing the usual 46 and some containing 47. So we know that the error is in the 47. So it may sound a little far-fetched, but I have a nice little video to show you. So hopefully you can hear that. So the error comes with the cells containing 47 chromosomes. So those cells with 47 chromosomes contain an extra chromosome 21, right? So mosaicism is the least common form of Down syndrome and accounts for 1%. So only a small population. So here we have the same cell division, right? 43, 43, then we see 46, 46. But now here we're seeing 47, 45, 46, 46. So we know something is wrong here, right? So
mosaic Down syndrome,
here,
also called as mosaicism, is a rare advance, like 1%, 2%.
Sorry, Demi, could you turn it up a little bit? We're hearing, but it's low.
Why is that? Oh, okay. Let's see. Hopefully this helps.
As mosaicism is a rare advance, only 1%, 2% of Down syndrome. Those affected have a mixture of cell types.
We can hear that someone is talking, but it's really low.
Oh.
Then what you can do is go back to the sharing option and put your computer audio as well.
Is that more record on computer? Am I in the right place? Oh, no. Meeting disable. Invite. See my system. Should I change this? This is what you want me to change? Audio settings. Let's see. Not too sure how to fix the issue. Hold on. If it's anything we can skip over it, I would have liked you to see it, but it's no issue if we can.
Demi, I think what Najani was saying, initially when you start sharing,
yeah,
it gives you an option to share your computer audio. So perhaps you just need to go back.
So should I?
So you can maybe stop sharing and then start again. And
all right. Share. Okay. All right. Let's see.
Syndrome, also called as mosaicism, is
how's that? Oh, how's that?
That's great.
All right, perfect.
Mosaic Down syndrome, also called as mosaicism, is a rare and accounts only 1% to 2% of those with Down syndrome. Those affected have a mixture of cell types in their bodies. Some cells are normal and contain 46 chromosomes, while others contain 47, carrying an extra copy of chromosome 21. Body contains mixture of both normal cells and cells with 47 chromosomes. Mosaic Down syndrome is subdivided into two groups: cellular mosaicism and tissue mosaicism. Cellular mosaicism. When different cells of same type are mixed, this is called cellular mosaicism. Like normal cells with 46 chromosome and cells containing 47 in nervous system.
Tissue mosaicism. When one set of cells has the normal number of chromosomes, and another cell set has an extra chromosome 21, normal number in kidney and extra number in nerve cells. This is called tissue mosaicism.
Mosaicism results from a non-disjunction error that occurs immediately after fertilization.
Majority of cases of mosaicism happen when a zygote with the most common form of Down syndrome, non-disjunction trisomy 21, loses the extra 21 chromosome in certain dividing cells. This creates lineages of cells with or without extra chromosome.
Alright, so that was that. The final one is translocation. So in translocation, which accounts for 4% of the cases with Down syndrome, the total number of chromosomes in the cells remain at 46, right? However, an additional full or partial copy of the chromosome attaches to another chromosome. So maybe you can attach to, let's say, chromosome 11, chromosome 14 in this case, they give as an example, right?
The third form of Down syndrome results from Robertsonian.
So this is just a summary of it, right? So trisomy 21, translocation, and mosaicism, right? So a baby born with an extra copy of chromosome 21, meaning there are 3 copies of chromosome 21 instead of the usual 2, right? In translocation, part of chromosome 21 breaks off during cell division and attaches to another chromosome. So that's the difference between translocation and trisomy 21. Now, mosaicism, there's a mixture of 2 types of cells. Some cells containing usual 46 chromosomes and others containing 47. All right, so that's the difference between the 3. Just general knowledge. So the prevalence, based on studies abroad, about 6,000 babies with Down syndrome are born in the United States each year. Right. So risk factors. One of the biggest risk factors is maternal age. Right. So mothers, babies born to mothers who are above the age 35, they are at higher risk of having children who has Down syndrome. So this is just a graphical representation, or picture representation, I should say, of the incidence rate of Down syndrome. And we can see as a person gets older, mother gets older, the chances of having a child with Down syndrome increases significantly. And this information was taken from the Down Syndrome Society, right? So environmental factors. Now, there is no scientific evidence behind it. However, logical deductions have been made because of how genes are affected by environmental factors. So on the site as well, smoking during pregnancy increases the risk. Radiation, pesticides, living near waste disposal facilities, exposure to infectious agents and various viruses during pregnancy. All these factors increases the likelihood or makes a person more at risk. Right? So some of the complications, especially with my patient, heart defect as a baby, he had to do major surgery. Actually, he had to do an open heart surgery. So around 40 to 50% of children with Down syndrome have a congenital heart defect, right? So they're born with that. Around 60% require treatment in hospital, and the most common types of congenital heart disease are known as septal defects, which he had, which account for 9 out of 10 cases. So you can see it's something that occurs a lot, right? So we can see the defect right here. So this is a normal heart, and we're seeing the defect here. So less common types of congenital heart disease include tetralogy of Fallot, which accounts for 6%, and patent ductus arteriosus, which accounts for 4%, right? These are just things that children with Down syndrome would experience, right? So minor septal defects can usually be treated with minor surgery. Larger defects will need open heart surgery to correct, right? As I explained, he had that as well. So this is one of the important ones as it applies to us. So musculoskeletal defects, because this is more in our area of treatment when it comes to these patients. So the most common musculoskeletal effects in Down syndrome will include weak muscle tone and ligaments that are too loose, or ligament laxity, we call it. This leads to excessive joint flexibility. So you're probably asking, what is the importance? Why is this something to note, especially for us? When it comes to your ligaments, especially ligaments in your neck, right? These are important ligaments, especially when it comes to movement. So if you have movement in the wrong direction, especially when it comes to your neck, actually, like let's say, yeah, a dontoid process that's close to your medulla, right? So if you have, let's say, a short neck, which most Down syndrome children have, what can happen, or they can be at risk of, sorry, what can happen, or what they can be at risk of, is that there can be compression happening to the medulla, and that happened to him, and that caused him to have neurological symptoms. So he had a phase where he went into some neurological shock, and that's what affected his state, and he became quadriparesis. So he lost some feeling in both upper and lower limbs. So those areas were affected because of that, right? So here we can see a baby with decreased tone, right? So neck instability. In many children with Down syndrome, the muscles and ligaments that support the neck are too weak and too loose. This can potentially cause spinal cord compression. And this is what will cause a lot of the neurological signs and neurological symptoms, in which small bones in the neck, vertebrae, press on the spinal cord. Compression may lead to reduced muscle coordination, numbness, and weakness. Oh, sorry. So this neck instability, this is very important, especially for this population, right? Because as you can see, it can lead to compression, and this compression can cause either you can be quadriparesis, or you can be a quadriparetic, which means you have no movement, or you may have some movement in the upper part, and the lower part, which is the lower extremities, the lower legs, you can have no movement at all. I apologize for going a bit fast. I didn't realize that I was speaking quickly, but you can stop me when you don't understand something, or if I am going a bit quickly. That's all fine and well. So anything that I've said before, you need me to revisit, or did I go too fast and you need me to explain again?
Can I see the slide with the slide before with that baby? I just want it right.
Oh, yeah. So a normal baby would not present like that. I should have put in here a picture of a normal baby, but as you can see, it just looks very flaccid as as he's being held. Right. So everything else thus far, has it been fine, or you want me to go over anything else? No? I can't necessarily see the chat if anyone messages. Right, so spinal cord compression does not occur in most children with neck instability. However, any progressive physical change in a child with Down syndrome should be brought to your doctor's attention. So they are very fragile kids. They can be very fragile kids, and you need to take into consideration this when treating them, right? So weakness, clumsiness, and tripping, walking with stiff legs, having a stiff neck pain, and headaches. All these are things that need to be reported, because especially with the patient that I had, again, Down syndrome, had a fall. After the fall, probably like 2 months after, he started falling more. Things would drop out of his hand. So it's something to pay attention to. And he later developed cervical myelopathy, right, which is compression of the spinal cord, but his one was severe, right? So again, things to note and things to pay attention, and this is extremely important for us. All right, so joint instability. So hip and knee, all of these things are things that can experience. So a lot of the joints can experience this dislocation and stuff like that. All right, especially the hip is a common site. So here is a photo of, you can see on the where the red arrow is, where it looks different from the other side. So here we can see hip dislocation happening. Right? Any questions so far? No. So kneecap instability. Again, you might ask, what's the importance of knowing this? The kneecap slides up and down.
Oh, I was about to ask a question.
Go ahead.
So you were saying that the children suffering from Down syndrome usually are really fragile physically.
A lot of them are. They are predisposed to a lot of different conditions from an early age.
Okay, let me rephrase. They're predisposed.
Yes.
What are some of the measures that persons would or specialists would probably tell their parents to like employ so their kids can live somewhat a fullish childhood rather, while still maintaining precautions?
You know what? I have it in another slide. What they did, right? When I was researching, I saw that they have a plan or a schedule for them. So as they go on later in life, so dental appointments are regular checkups is a necessity for them. So what I saw is that they would have a schedule for them. If you know what, let me show you. Stop sharing. Just no. I want you to see this. What's the name of this document? Modern angles. Right. So this was actually my original, but this is a lot more. Just let me show you, because it will answer your question. Right. Here, you can see, so from birth to 6 weeks, 6 months to 10 months, all of these, and here tracking growth, right? The integrity of the heart, thyroidism, so the thyroid, sight, hearing, all of these things, having regular routine checkups.
1 second, Demi, we're not seeing your slide.
Oh, sorry. Okay, share. And I'm talking away like you see, Right. So this is what I'm saying. It's a guideline for regular checkups for them. So it's important that persons keep up to date with their progress and how they're doing. So eye exams, regular doctor checkups, hearing tests. So this is what was suggested in one of the medical journals to do to ensure that they are progressing quite okay. So does this answer your question?
It does.
Okay, perfect.
Thank you.
You're welcome. No. Right. So seeing this now, right?
Did you change from that chart? Because
you only seen the chart. Okay. Stop sharing, share screen, and we are back.
Yes, we are.
All right. So here, so this is a normal kneecap. You can see the patellas over the groove and whatnot. Here we can see deviation, or the patella is no longer in the groove. So we have subluxation and dislocation, which is C, which is it completely moves off of the groove, basically, right? So foot conditions, flat feet, bunions, all of these things are things that they experience. So oral health, again, he had to do dental surgery early on. I think when he was, before he was 10 actually, he had to do dental surgery because he experienced issues. So many Down syndrome children experience tooth decay and infection of the gums and stuff like that. Thyroid problems also is another issue that they have. So around 10% of people with Down syndrome have problems with their thyroid gland. So hypothyroidism is the one that occurs most often. But so some of the symptoms are lack of energy, weight gain, slow physical and mental reactions, muscle aches and weaknesses, dry and flaky skin, right? Hyperthyroidism is also something that they experience, but it's rare as compared to hypothyroidism. So they tend to be hyperactive, have difficulty breathing sometimes, mood swings. One second. Right, so they need to pass stool or urine frequently. Also happens, right? So increased susceptibility to infection. So persons with Down syndrome are 10 times more likely to develop an infection compared to the general population, particularly lung infection, pneumonia, right? Again, they are predisposed to precancerous conditions such as myelodysplastic syndrome, potentially cancerous conditions such as transient myeloproliferative disorder, and cancerous conditions like leukemia, right? So what is leukemia? It's a form of cancer which affects the white blood cells, the cells responsible for fighting infection and protecting against it. So now if your defense mechanism, right, has issues, then you're going to have problems fighting off infections. And that is an important thing to note. So blood disorders as well, something that they experience. So there are some abnormalities such as increased or elevated number of red blood cells, enlargement of red blood cells, so polycythemia, macrocytosis, thrombocytopenia. Now this is a decrease in the number of platelets in the blood. Thrombocytosis. I won't go into depth with all because this is not our focus, but it's just things for you to note. Right, intestinal problems is something that they experience as well. So constipation, diarrhea, and indigestion. He also experienced the constipation aspect of it, right? And I'm not sure if you guys are familiar with tilt table therapy, right? That would have been something I would have done with him. However, because of his injury and the rate of healing of his injury was slow, I couldn't put him there. So a lot of the complications that come with Down syndrome, he experienced, and that allowed me to have a better understanding of it, right? So another, so an estimate of 5 to 15% of people with Down syndrome will develop celiac disease, which is a condition where a person has intolerance to gluten, a type of protein found in most cereals, right? So now we're coming closer to aspects more centralized around you guys. So there are psychological and behavioral conditions that are associated with persons with Down syndrome, and I experienced that with him. So attention deficit hyperactive disorder, a behavioral condition that is characterized with characterized by a short attention span and impulsiveness. So with him, right, 1 minute he will be fine and he's doing the exercises, and the other minute he doesn't want to do anything. He wants to sleep. He's tired. All sorts of different complaints. Like once he came, with him I had to be very, how to put it, very routine and structured with him. So if he came, he must be underneath the fan. If he's not underneath the fan, so there was an instance where I couldn't put him underneath the fan because the area needed to be clean. And he cried, screamed, and bawled until he was placed under the fan. But this is something that it took me understanding what was his condition and trying to understand him to be able to deal with him properly. So that's something that I experienced with him. So autistic spectrum disorder is something else, a development disorder that can cause problems with language, behavior, and social interaction, right? So not everyone could understand what he was saying, but because of the fact that I was around him so much, I could I can tell the things that he was saying. So he would say "want down," but I understood that he no longer wanted to sit up, but he wanted to lie down. So small things like that. So instead of saying Porter, he would say Walter, but I recognized what he was trying to say because he would point to me and show me. So within treating him, I had to learn his language in order to come to be on the same page with him in order to treat him. So I had to learn his likes, his dislikes, and try to incorporate that in my treatment with him. It was a challenge, but it's something that I had to do because this was my patient and he needed me to help him to get where he wanted to be. So that's something I experienced. Depression, a condition that causes persistent feelings of extreme sadness. Obsessive compulsive disorder. These are just things that they listed on the autism site as when I was doing research and I found it. So I brought it back here. So dysphagia is a potentially serious condition because it is possible for small pieces of food or drink to fall down into the lungs and trigger a serious infection. So I would also be mindful when going to treat him to find out when he would have lunch and schedule my treatment session with him around it, because aspiration pneumonia is something that can occur if persons are not careful, right? So this is known as aspiration pneumonia and can often be fatal. Mild to moderate dysphagia can be treated by making simple dietary changes. For example, eating soft foods that are easy to swallow, such as soup and mashed potatoes. Yeah. So Alzheimer's, another challenge the brain can face for those with Down syndrome. It's the most common cause of dementia. You know, there's a correlation between Alzheimer's and dementia, right? So dementia typically involves symptoms including memory loss, difficulties with thinking, problem solving, and or language. And these can occur due to damage to the brain, such as caused by Alzheimer's. Right? Vision problems, another complication experienced by these persons. So around 50% of people with Down syndrome also have problems with their eyesight. So some may need surgery to correct it and others may not. Excuse me. So other eye problems, lazy eye, short-sightedness, long-sightedness, eye infections. I didn't experience any of that with him though, in terms of eye infections. Right, so any questions, any concerns, anything? Or can I continue? No, okay. So, is that a question?
Oh, that's a comment to continue.
Oh, okay, no problem. So cataracts, nystagmus, and keratoconus, sorry. Where the cornea becomes thin and bulges out. But I think from the photo, you guys realize that the eye is, even with him here, this young man, the eyes give out that characteristic or that feature to pinpoint persons with Down syndrome. usually. Um, so physiotherapy management. So one goal of physical therapy management is to minimize the development of compensatory movement patterns that children with Down syndrome are prone to develop. Working with their muscles and movement will help reach some of their motor milestones and will prevent them from developing problems such as bad trunk posture and gait problems. Right? So what I'm gonna do, I'm going to give you a sample of what I did with him, right? So we can basically be on the same page and understand each other. That's before I go into the other part. So here's a little baby, and he's doing a bit of gait training, right? And yeah, balance training on the Bosu ball. So here we have our baby walking around. So all of this is to help with one, his posture when standing and his movement with walking. Yeah. So here again, trying to trying to work on a bit of balance and sitting, right? So this is the problem list I had with him, right? Remember I told you he was quadriparesis secondary to cervical myelopathy, and he also had Down syndrome, right? So impaired ventilation, a weak cough, decreased muscle strength, dependent bed mobility, impaired balance, dependent transfer, and dependent wheelchair mobility, and impaired sensation. So because of the level of the injury, sometimes persons can have impaired alveolar ventilation. So there isn't a sufficient supply of oxygen transmission happening. Also a weak cough, because again, depending on the level of the injury, you can have this. Persons with Down syndrome do not necessarily need to be quadriparetic. They can be normal without any problems with breathing. Just to note, these photos here, these are from the internet. This is not my patient. This is not anything like that. Just letting you guys know. Basically got this from the internet. So they're random photos. So also, right. So you don't necessarily have to have any respiratory issues with a patient, but you can have this happening. So if a person has a high level injury and they have let's say quadriparesis, where there is weakness in the limbs, when he or she is unable to walk at that particular point in time, we the therapist will step in and take that patient from being able to not being able to move in bed to be able to, let's say, side lie, to roll, just lateral movement, and basically up and down, so lateral and vertical movement. We assist with that. Also, if they're unable to sit up, we do balance training with them. If they're unable to transfer training, so either from the bed to the chair, or let's say bed to chair to toilet. All of this comes within their training session. Also, wheelchair mobility, being able to propel themselves, or to propel themselves with some level of assistance. Also, impaired sensation. So this is just what I did with him, right? So my short-term goals would have been, to have normal songs, improved cough effectiveness, right? Improve the muscle strength to at least by 1 grade, right? Bed mobility with moderate assistance, fair static short sitting balance, and independent bed mobility on level surfaces, right? So My goal as a therapist is to assist my patient to achieve his goal, right? And if it's mobility, then I want to take that patient from not being able to move around as much to being able to reach his highest potential, right? So this would be an example of short-term goals that we would have for that a patient with that kind of condition, right? However, we would have to revise it based on his response to training. Treatment. So long-term goals, what we would want is to achieve um, independence as close as possible. So we would want functional muscle strength to be able to, let's say, so hold a cup, to pick up something that he would need to pick up, small tasks that um, is a part of his daily life, or her daily life, depending on the patient. So fair, static, long sitting, being able to move it in bed with one plus one assist, meaning with at least one person assisting you, and you know how to instruct that person on moving you, right? Patient will propel with wheelchair and ramps, with plus one minimal assist with adaptations. So sometimes patients are not always able to do the task um, as normal as possible, but we make alterations for that patient. So plan. The patient like that will do balance training, strength training, functional activities. So let's say the patient is a young patient, right? And patients who are of the younger generation will tend to like being on their device more. So it's how would I incorporate this person being on their device and wanting to do or participate in therapy, right? So you can either we would either, let's say, play a particular show that they would want to watch. So while we're doing therapy, they look at the show. But it's basically just having a balance of one, completing therapy, and having them do the activities that they like, right? So it forces creativity in planning a program for a patient. So again, just physical therapy if the patient has a high level injury along with having Down syndrome. Or if the person does not, we'll just work on regular muscle strengthening exercises, right? So as we saw from before, tone is an issue with these patients. So muscle strength programs are important for them. It's highly beneficial, especially when it comes to good posture. All right. Tilt table therapy. Does anyone know what tilt table therapy is? Yeah, no.
I'm gonna go on a limb and assume it has something to do with a tilted table.
Okay, so
I
basically.
don't know how it factors into the kid.
Okay, so if you have a person that has been recumbent for a while and you are reintroducing, let's say, walking and stuff like that, or even if the person is constipated, you can put them on the table basically to encourage bowel movement, right? So it's like a flat table. However, just like we would have those what you call them. So basically, you can increase the increments on the table to a point where the person is upright. So you go from lying flat to being vertical. I don't know if you can picture that.
So it's like an adjustable table.
Yeah.
Yes, it is.
Okay.
Right. So that's something. Education of parents, we need to ensure that the parent understands the complications and understands what comes with having a child with Down syndrome. Because if your parent of the patient doesn't understand, it becomes difficult sometimes to get what you need to get done, and they become frustrated with the process as well. Some days the patient will be very cooperative, and other days it's going to be a task, and it's all part of the entire experience. So, psychological effects of exercise. So, before I go into that, especially if you have a patient that has been lying there for an extended period of time, right? You both know that posture plays an important role. So, an upright posture basically sends a message of confidence, and it affects a patient's mood. Also, if you are lying for an extended period of time, chest physical therapy is important, meaning so bronchopulmonary hygiene is something we take into consideration. So we do a lot of deep breathing exercises with them, and we'll tailor the treatment basically to their needs. So posture is an important part in all of this. I just wanted to mention that before I started. So psychological effects of exercise. So prevents cognitive decline. One of the biggest psychological benefits as a result of exercise is that it prevents cognitive or reduces cognitive decline, I would like to say. As people age, their brain tends to become less sharp, and neurodegeneration can set in. In people with dementia, exercise has a moderate effect on their ability to perform activities of daily living. So researchers suggest that it improves cognitive function. So studies have shown individuals that do not take care of their cardiovascular health are significantly more likely to develop dementia. Right? So neuroprotective agent. All of these points have been backed up by studies. I have the links for them if anyone is interested. So it has also been shown that individuals that develop Parkinson's disease end up losing significant numbers of dopamine neurons as a result of toxins. So one of the most effective ways of protecting your brain from falling victim to neurotoxicity is exercise. So here we are seeing the benefits of exercise, because we know once we start exercising, there's increased blood flow to various sites, right? And that is the effect, or this is the effect, sorry, of exercise here. So anxiety and stress. It reduces the level of anxiety and stress because of the neurotransmitter release that goes on. So we have increased release of dopamines. I think we had it here. No? Right. So basically, when we are exercising, this chemical release affects our mood, and it can reduce our anxiety levels and reduces stress. Right? It is also another effect that they found. So have you ever experienced, like, after you finish a session of exercise, you just feel rather relaxed, rather calm, like your mood is different? Anyone has ever experienced that?
Most definitely.
Right. So at least we know that we've been exercising to some extent. I know that has decreased since COVID. Don't worry, I'm almost finished. So improving learning and memory. In most studies regarding exercise and learning, it was found that people who get more exercise tend to be quicker learners. It is well understood that exercise improves overall cognitive function. Researchers have gone on to study how long people are able to reap the improvements in learning and memory following exercise. So they did a trial with some with mice, right? And basically, in one group, they had the mice running on wheels, and in the other group, they had mice with a bit of weight on the tail. So both studies reveal that there was improvement, right, in those mice. So it's also shown to increase this weight, right? Right. That's what I wanted to mention from here. So increase in pain threshold, a study in 2010, right? The endorphins released as a result of exercise create a mild sense of euphoria that increase pain tolerance. So here we have the endorphins part coming up, right? Um, Not only could exercise increase your pain threshold as a result of your body's biological response, additional research suggests that regular exercise can actually change an individual's perception of pain. So reduces oxidative stress. So we talked about that a little before. Enhances brain plasticity, right? And these are just three of my references. But this is the end of my presentation. I hope that you were able to understand what was being shared. And if you have any questions, feel free to ask.
Wow, thank you, Demi. That was so much. You know, I think we may need to invite you to come and do some therapy with us.
I'll take it tipping up.
Sure.
I was saying we maybe need to invite Demi to come back and do some actual physical therapy with us. Because I'm hearing people saying they're not exercising, and we know we need the brain, right? For over psychology, we need to study all of those things.
We actually have a movement called Physio Moves. We've been trying to get that back up and running. It's online actually. So one of our committee members, he carries out this session, and it's usually a fun session, soca and stuff. So if
all right, she sold me on soca.
Wow. Yes, nice little session that we have.
Okay, thanks so much. So guys, any questions for Demi? That was a lot of information. So give us some feedback.
Well, I'll start it out. For especially the information that I've met with today, I know that I had like bits and pieces of trivial information cross my path, but not to the extent that I had today. So it's not particularly a question, but more like commentary on just how deep this presentation went. I didn't know that so many different afflictions can be major predispositions towards persons suffering from Down syndrome. And just like, especially how much harder it could be now that there is the isolation and this like intense period of depersonalization. So thank you for opening my eyes, Demi.
It was my pleasure, honestly.
Any questions, guys?
Okay, so my audio is really terrible. I'm sorry about that, but can you hear me enough to discern the question?
We can hear you.
Okay. I have two questions. First question is kind of silly, but I'm curious, or I always wanted to know. I see physiotherapy and physical therapy used interchangeably, and I just want to clarify if it's just entirely the same thing. They are interchangeable, and there's no difference between the two terms in terms of what is practiced.
There isn't a difference, however, based on the region, persons will say physical therapy or physiotherapy. So you would notice that person in the US would say physiotherapy, but Caribbean persons will say physical therapy. So it's used interchangeably.
Okay, thank you. Second question I had, it's not really related to Down syndrome, but kind of more the field you're pursuing in general. I wondered if, as a part of your training for physical therapy, is there any aspects of it where they focus on the psychological aspects of what you do? Meaning, like, you mentioned that in treating your patient with Down syndrome, there were some cognitive components and some behavioral issues that may have came up. So is there a part of the curriculum where they teach you specifically how to engage with patients that may have some kind of behavioral components that make it difficult to treat them?
Honestly, there isn't any in-depth training that I received prior to meeting this patient. So a lot of the things I had to learn on my own. So maybe if I furthered my education in let's say that arena, or gone on to do my master's, I may have more exposure. But right now, as the curriculum stands, there isn't any in-depth training when it comes to conditions like these. So you may get, let's say, a brief explanation, or you may, you may browse on the topic, but to equip you to treat a patient like this, no, not so.
Okay, thanks for that.
Did I fully answer your question, or is there a piece missing?
No, you did. You fully answered it.
Okay.
Any more questions, anyone? Going once.
I have a question.
Okay.
So Demi, in light of the disability and the impact that things that maybe we would take for granted, how do you see all of this impacting the child or the patient, whether it's a child or an adult? What are some of the things you have observed?
Okay. With him, in particular, because I can only speak from my experience with him, but in general, I've seen the way they tend to be a bit affectionate. Like, positive reinforcement is something that I can't stress enough. Like, I would, in order to get him to do certain things, I would have to be like, "Oh my, look at that, good job!" Like, you won't believe. Also, like, compromising. Well, what this is what I've seen, that just making them comfortable. So sometimes I would have to lift the leg and like put it on my lap while I trying to do something else. So it's a bit of multitasking that came out of the situation, because one, comfort, in him feeling comfortable impacted how I treated him. That's one. Also, him feeling accomplished with certain things. So if someone came passed by and see him doing something, and I was like, "Oh wow, look at you! You're so strong," or something like that. So the psychological factor is a huge bit when it comes to things. Comes to treating these patients. The way that you interact with them. Especially like if he knows he did something wrong, or he let's say he was being a little naughty, and I give him a little time to like relax and whatnot. I would see him watching me in the corner of my eye and calling to me, but you have to give him time to like relax and then come again. So it's something that you would have to experience to interact with them, because each patient would be different. The likes and dislikes would be different. The way that they behave would be different. But it's about getting to know and understand your patient on that level in order to give them the best treatment that you can possible. So
I have another question.
Sure.
So I was just thinking, what's the quality of life that we can expect for an average individual with Down syndrome? Meaning, like, what percentage of the population ends up being able to be fully self-sufficient, can live on their own, deal with their finances, etc.?
Oh, okay. I haven't seen any local studies. However, based on experience, sometimes they may be able to be a bit more independent, especially if they don't have another condition, a serious condition like that. Because the life expectancy, what I've seen, it has been up to like 60 years old, right? But it would vary from person to person because of the cognitive factor. Because some of them can be, it will differ. So some would be more childlike as compared to others. So I can't necessarily say, but I know there is a possibility.
Okay, thank you.
Yeah.
Any other questions, guys? I have one, but I'm sure you guys have some questions. Don't be shy.
I don't bite.
I wanted to have an idea of the cost though, Demi, because the cost and also what are some of the reactions you get from the parents? I know you mentioned it briefly in your presentation, but how involved do they get, and is it, do you find you have to refer the patients, to other services and so on to facilitate coping?
Most definitely. Depending on the behavior, let's say if the child is very erratic or have a lot of episodes where he or she would misbehave, I personally would like to refer to a behaviorist. That's one. Speech therapy is another treatment option for them. Like it all depends on the complications or the attached conditions that the child would have. So then you would know how to refer. So for, let's say, okay, let me give you an example. So with a child that, let's say, not how to say, can't express him or herself in a way for someone to understand, I would want to have that child see a person that can deal with that. So it assists me in my treatment. I didn't have that at the point in time because there wasn't anyone to specialize in that field. There was someone, however, that could probably, who gave me actually some tips, but she said to me that it wasn't her specialty. But it is important that the parent understands, because that's where the frustration comes in. If a parent doesn't understand why a child is behaving the way he or she is behaving, then they're going to be thinking that, this child just spoiled, and they may take some actions that, had they understand, they would not have done it. Right. So that communication between the medical team and the general, when I say medical team, I mean everyone from the doctors, nurses, psychologists, that whole cohesive and holistic view is important for not a patient, a parent, right, to understand what it is the child will experience and how they deal with that will reflect on the relationship that they would have with the child. Because if you have a child that's screaming 24/7 and they don't understand why, you as a person will get frustrated. So that's the how to put it, that's the aim, to have everybody on board, and especially the parent, to understand what's going on. I think there's a piece of your question I'm forgetting to answer. I can't remember which piece.
I think you pretty much covered it, because what I was looking for was to see how involved the networking is for the different fields in terms of health, how everybody would fit in, So I'm glad you mentioned the behaviorist, because it would mean that both the child and the parent would maybe need to get some support.
That's super duper important, honestly. Especially when you have a child acting out during therapy, and you yourself can't explain, and not, especially with me, I wasn't sure of how to deal with the situation, and thankfully we had someone on board to advise me on how to move forward with him. So it's sometimes people take it for granted, but a holistic approach on a patient is super duper important. Having everyone there to discuss the patient is important. So any more questions?
Yes, guys, any more questions?
I had another question that was pretty similar to the one Alex just asked, but I was wondering what kind of dialogue you would have as a physical therapist of a patient. What kind of dialogue would you have with the parents in terms of creating and maintaining the treatment plan? So I know, at least in some of the experience I've seen, sometimes parents are encouraged to continue parts of the physical therapy with their children at home so they can do little practices at home if they can. Is that something that's normally encouraged, and what other kind of guidelines do you give the parents as a clinician treating their child?
Okay, so home exercises is something that we stress a lot because we only have so much time with a patient in the clinic or wherever, whichever setting, right? So continuing that program outside of therapy sessions is important, especially if you have a patient with certain complications. So muscle strength you can't do, let's say, only an exercise once for the week and expect a significant improvement. So consistency is key. So we would usually do a home exercise program for them where we give the amount of sets, the amount of reps, how often you do it, the instructions on the various exercises that we would give to, in this case, it would be to the parent for them to ensure that the patient completes the various exercises. So that's something that we would do with them. Also, we stress the importance of doing it, right? So what the benefits of it, and if they don't do it, what are the repercussions of not doing it? Yeah, so that's what we would do.
Okay, thanks for that.
No problem.
Oh, I think an additional part of that, sorry, was that I was also asking if there are any other guidelines that you give the parent in terms of what the entire treatment of your patient is going to look like. So anything regarding the prognosis that they should expect, or any other little thing that they can do as a parent to support the child outside of doing exercises at home, or anything else.
Most definitely. So what we usually have, sometimes we give them a pamphlet. So the information that I've presented to you today, there are usually a lot of pamphlets that we do. So what is the disorder, things to expect, what you call it, things to expect with the condition. So we would have that dialogue with them as well. However, once it's in the public setting, they would usually have other persons of the medical team referred to them. So yes, we would educate them on the condition and whatnot, but in terms of fully grasping what to expect with a particular patient, we would leave certain details to a particular profession. So let's say the child has a lot of what you call it, cognitive issues, or let's say behavioral issues. We would leave that to the person who is in charge in that particular field. Yes, we would probably suggest that the patient see a profession, but most of it will be on education on what the condition is, things to expect. Probably life expectancy is something as well to note. But like I said, their life expectancy can go all the way up to 60. So it depends on what conditions they have associated with Down syndrome.
So Demi, we are aspiring psychologists, right?
Mm-hmm.
So we are in our field and we have persons who, because what I've realize is that with just about any disability in Jamaica, it's almost taboo. So you'll find parents who will be in denial, right? So how would we get persons now to seek out your kind of support? You know, is there an association? How would we, seek to make contact if it is that we recognize that these persons are in denial, or if they know they don't know how to go about seeking help?
As far as I was told, there is an association locally. I can't remember the exact name off the bat, but there is an association. So if it is that persons are looking for information, there is means and ways of finding it. If you want, I can source it for you and send it, because I know it's an issue of persons not wanting to accept sometimes what their child is experiencing and whatnot, and that comes with its own challenges. But I think with more awareness of the condition and that can change, because with more acceptance, more persons saying, okay, my child has this, and he's still doing fine, and to highlight that this is not the end for a child with this condition. They can go on to accomplish so much more, and having that parental support as well as medical support, that will aid in their success, right? And once parents are seeing that success, I think it will increase the awareness, and two, the acceptance of it, and then persons will be reaching for support and reaching out for help. So I think awareness is something that we need to stress, both physical therapy and psychology students, because we do work in conjunction with each other when it comes to patients like these, especially because the psychological aspect is an important part, and it's something that we can't ignore.
I would say very well said, Demi, and I'm looking forward to that information, because perhaps we can share that on our website and so on, because I would imagine that persons who have this kind of experience and are not equipped would feel some significant psychological pressure, so we'll be more than happy to share this kind of information on our social media pages, so that persons can be informed and can know where to get help, because a part of the psychological treatment as well is to give information. Information can really release a lot of anxiety. So I really thank you for partnering with us today. And my group is, our club is unusually quiet today. I imagine there's some self-reflection, because I really never imagined that the challenges were so varied and numerous for these patients. And it has really, opened my eyes to how fortunate we are.
Exactly.
And so blessed, so I think it's food for compassion. Right. So I really want to thank you, Demi. I know it's exam times, and I know you mentioned that some of your club members would have, your exec and so on would be in classes still, and I really appreciate that you have taken the time to come and give us such rich information on, the treatment of Down syndrome. And yes, we would have been exposed to the different disabilities from a cognitive perspective, but certainly this was like hands-on information, and really truly appreciate your time spent with us this afternoon. And we hope that we can do further collaborations. Maybe when the pandemic has passed, we can maybe do something in the physical.
I second this notion.
Yeah, maybe we can do some outreach or something together, so that we can impact both the physical and the psychological.
Demi, just an off-topic question. Where are you from?
I am from Trinidad and Tobago.
Okay. I was like sort of sure, but at the same time, I felt bad thinking that every other accent I hear is from Trinidad. Like, what happened to the other states? So I wanted to just ask.
Yeah, man, I'm from Trinidad.
Well, big up Trinidad.
Thank you. I honestly enjoyed this, guys. I really hope that you guys learned and it wasn't too boring because I know it was a lot of information.
No, we learned.
Oh man, it wasn't. It wasn't. It was nice.
Right.
So thanks everyone for coming out. I'm sure you walked away with a lot. I did, at least. And we can, you know where to come back to find engagements such as these. Same time, same place. I'm sure my exec would also like to say their parting thanks.
Well, you all heard from me already. So the other exec members who are on, feel free to, thank our guests. They're so faithful. We keep seeing the same names every week, and we really so much appreciate your support because we really would have no one to present to and to serve. So we really thank you for coming out week after week. So I'm going to be quiet now, and I'm just going to ask the rest of the team to just, just to show their appreciation.
Right, Kajambo?
Thank you for information, because I don't know why Marisha threw us on the spot like that.
So sorry.
I ask you, what's the @ for your club on Instagram? Because I want to follow them. So if you could just share that information in the chat so we can follow them on Instagram.
Oh, yes.
Short and simple.
So at UEPTSA?
That's it.
Okay. Okay.
And if you can't remember, just think of UE, Physical Therapy Students Association. So you should see your following increase, Demi.
Yeah, someone just followed you, and I'm gonna join.
We would return. I would speak to the PRO and have those followers return.
And when is it the same meeting time for your club like our club meeting time?
Yes, it is, but we don't usually have regular meetings like that. Because of how hectic school can be, I don't really trouble the study time and whatnot. So we would have various activities throughout the semester, but to say we have constant regular meetings, no.
Okay, thank you.
Well, Demi, please feel free to let us know when you're having your meetings so we can advertise if it is something that is, a benefit to the general public. So we can advertise and see how we can participate as well. Because I realize this integration of knowledge is really important so we can be able to identify things and, refer and so on. I think it's very important that we are integrated.
Sure, no problem. So guys, I have to go now. It was nice being here.
Thanks, Demi.
Lovely meeting you guys virtually. Bye-bye.
Bye. Okay, so Najani, you are gonna close out the show with some music and then we just stop. All right, I'm gonna have to sing for you if Najani doesn't respond.
Yeah, come we sing Aldis.
It sounds like Marisha wants to sing.
Hey, don't try it. Bye, guys.
I'm not sure where Najani is, but thank you guys so much for coming out again. And this is where we end for today. Oh, he's here.
For me.
Later.
Darling, just dive right in. Follow my lead. Well, I found a girl, beautiful and sweet. Well, I never knew for me. 'Cause we were just kids when we fell in love, not knowing what it was. I will not give you up this time. Darling, just kiss me slow. Your heart is all I own, and in your eyes you're holding mine. Baby, I'm dancing in the dark with you between my arms, barefoot on the grass. We're listening to our favorite song. When you said you looked a mess, I whispered underneath my breath, but you heard it. Darling, you look perfect tonight. Well, I found a woman stronger than anyone I know. She shares my dreams. I hope that someday I'll share her home. I found a love to carry more than just my secrets, to carry love, to carry children of our own. We are still kids, but we're so in love, fighting against all odds. I know we'll be alright this time. Darling, just hold my hand, be my girl, I'll be your man. I see my future in your eyes. Baby, I'm dancing in the dark with you between